Hey there, good morning, everybody. It's Dr. Karen here, and I am going to talk a little bit about dyslexia and the SLP's role. So, there are a lot of questions that have come up recently in some of my mentoring programs for SLPs about where SLPs fit in when it comes to supporting students with dyslexia. So, are we qualified to treat it? What's our role? Where do we fit in? Especially when we're considering schools versus outpatient clinics and medical settings. So, I wanted to take just a couple minutes to address this question and talk a little bit about whether it's within our scope and then practically how we can actually address this. So, number one, the question is are we qualified as SLPs to support students with dyslexia? So, obviously, the short answer is yes, absolutely. There are a lot of theories about dyslexia. Some people think, they say it's just dysteachia, meaning it's just students who didn't get proper intervention. And, if we give them proper intervention, then, everything's going to be fine. They say it's more of a teaching problem rather than an individual problem. And then there's the other side of the spectrum that says, yes, there are neurological differences when it comes to people with dyslexia. So, with that whole range of ideas, we know, yes, are some students erroneously diagnosed because they didn't get good quality intervention? Well, yes, that happens. But we also know that people who tend to have that dyslexia diagnosis or that have other related diagnoses, maybe just learning disability, things that are a little more general, we know that they have a certain profile and certain things that they struggle with. Many of those things being language based. So, issues with phonological processing, issues with morphological awareness and vocabulary and comprehension, all of things that are going to impact their decoding, their ability to read, write, spell, and perform in academic settings. So, all of those things that are extremely language based. So, because these individuals present with a lot of language based issues, that we know all of those things, if you address those types of things, phonology, morphology, vocabulary, we know that that's going to result in a functional improvement. So, because we know that this is a language based issue and we know that remediating and focusing on those skills can actually improve them and improve functioning, absolutely, yes, it is within your scope of practice to be able to address these issues and support students with that diagnosis. The other question that comes up is can we diagnose, or also why, if you're working in the schools, do we not use that term? So there are a couple of things to consider here. And number one is school terminology versus medical terminology. If you are working in the school systems, because you are in a school, many districts, just because of rules and regulations, we can't use medical terminology. And because of the facility that we're working in, we can't give that particular medical diagnosis because we are in an educational setting. We have to use the educational disability categories and those eligibility categories that are outlined by your state and your district. So that means that if you are in a school setting, that you might, with your team, do a battery of assessments on a student, and then they might be identified as having a specific learning disability in reading. Or maybe they might have something else. You might pick another eligibility category, such as speech and language impaired. Maybe they might have another health impairment if they have other diagnoses and they actually have some outside testing. But that's not the label that you're going to use in the school systems in order to be able to provide those services. That's not the classification that you're going to give them on your paperwork so that you can support them because you're in an educational setting. Now, you could take that same battery of assessments and have people with similar credentials or maybe even the same credentials in a medical setting do that same assessment. And because it's a medical setting, they can use medical terminology. Dyslexia is a medical diagnosis. They can actually be the ones to officially diagnose it because they're in a medical setting. So in the schools, it might be called something more general like specific learning disability, but in a medical setting, they might be able to actually use that terminology. Now, which one is better? Well, honestly, it totally depends on the situation, on the level of skills of the practitioners in both settings. There are pros and cons to each. In the school, a lot of times those people have spent more time with the child, so they might have a bigger picture of their abilities and their skills, but they also might be more emotionally involved. So the assessment, in theory, being emotionally involved can certainly impact your judgment for better or for worse. Whereas people in the outside setting, they don't get as big of a picture. So yeah, that can sometimes be limiting, but they are a third party objective perspective. So that can have some benefits. So there's really pros and cons of both. Ideally, regardless of what setting you're in, you want to work together to support your students. But just know that that's why there are those differences. And I think it's really important for you to be aware of that and to be able to educate the parents, the other practitioners, as to why one setting is calling it one thing and one setting is calling it another thing. And just explain that it doesn't necessarily have to do with one is better or worse. It's just because of some of the legal guidelines. But with all that being said, you are certainly qualified to address a lot of those different things that might be an issue for a student who has a dyslexia diagnosis. Whether you think that they could get that diagnosis or whether they actually have officially gotten it. Sometimes that's just a semantic argument, not that having an accurate diagnosis is a good thing or a bad thing or whatever, but really the most important thing is having an understanding of what's going on with that student so that you can figure out where you want to support them and start developing their skills. So the other thing becomes where it's, okay, so we understand why the terminology is different in the schools versus private practices. We understand that, yes, we're qualified. And then the other question is, okay, logistically within our situation, whether you're working in a school or a private practice, what can we feasibly get to? Maybe we're qualified to do a whole bunch of different things, but maybe we don't have time to get to all of them. Maybe there might be certain things where we are probably the best person to be delivering that intervention. And then maybe there might be some other things that you could do, but so could somebody else. So we want to figure out how to divide and conquer and work with our team to figure out what that student needs and make sure somebody is doing it, whether you are the case manager, or whether somebody else is and you're working together. You might be aware that your student might need work in phonological awareness, for example. How this played out for me when I was in the schools many times is that I would be the one that was really diving into morphology and semantics and syntax because I knew that the other people weren't doing that. And then I would work with my team. So, for example, the special ed teacher would say, okay, well, you're really diving into the sentence structure and the different types of syntactic rules, and then you're really working on studying prefixes and suffixes and all of those things. And so I'm going to come over here and focus on more of the high level comprehension, and maybe figuring out, inferring vocabulary from context and having the more high level discussions, both of which I could do, but I only have so much time. And I know that she's doing a pretty good job with that other thing. So I'm not going to spend as much time on that in therapy, even though it's something I know my student needs. I know they're getting it somewhere else. And then there might be some other things. So for example, I know that I'm qualified to really work on some of those phonological awareness drills and exercises. And I know that I could work them into therapy. But let's say that I know there's a special education teacher or a reading specialist who's doing a really good job with that student. So I might not focus as much time on those things in my therapy in that particular situation because I know somebody else is addressing it, even though I'm qualified to do all of those things on that spectrum. Whereas, let's say I'm in private practice, maybe I have some more time. Maybe I'm going to take some more time to do all of those things, or at least more of those things. And then it's even better if you do have people, let's say you have a parent who is taking their child to some outside support outside of school, you can even, then they're on your team too. So you have even more people who can support that student. So there's a lot of different questions as far as how does this all work, but really the main thing is that you want to understand that student's profile, understand that you are qualified to address those things, but not feel attached to you being the one to deliver them. A lot of times just being a consultant can be really powerful. But there are certain times where you might be the best person to actually deliver that therapy. So you want to be flexible with it. Make sure that that student is getting everything that they need, whether you're the one who's providing it or not. So that's how we want to think about that when it comes to where do we fit in with dyslexia. A lot of times it's super case specific. Now, the other question is, okay, how do we figure out what are all those different skills that our students might be struggling with if they are a student who struggles to read, who struggles with vocabulary, who struggles with comprehension, many of those things that could be on the profile of a student who has a dyslexia diagnosis, or even just other types of disabilities that impact reading, spelling, language processing. Well, that is exactly what I cover in my 5-component language therapy framework online training. In this training, I have shared the framework that I used to consistently help my students get to their least restrictive environment. Back when I first started practicing, I really felt like I didn't know what I was doing when it came to treating language disorders. And I really hated not feeling like I knew what I was doing. So that's why I went back, got my doctorate, and really made it my area of expertise. And that's when I came up with this 5-component framework throughout the course of my doctoral research and my practice, because I was practicing in the schools at the same time. So if you're sick of spending a ton of time prepping and planning for sessions, and you want to walk into your sessions confident that you know that you are providing the best possible services for your students, I'd love to have you join me in this online presentation. Again, it's called the 5-component system to language therapy, where I really walk through all of those pieces that you need in order to have a research-based, effective system for language therapy that consistently boosts those language processing skills that are tied to things like high-level comprehension and decoding and all of those skills that your students need to succeed in school. So I'll share a link to that training in the comments below this video, and I'd love to have you join me. Thanks so much for listening.